why medical coding is one of the best careers this year and last year and couple of years back. Hello guys, welcome to our channel. In this episode, I will teach you everything how to become a medical coder for 2022. I am the medical coding guy. Hello everyone, I am a medical coder, educator, and friend, the medical coding guy. Medical coding is one of the most in-demand jobs in the healthcare industry this 2022. Before we begin, if you have a minute to spare to hit that like and subscribe button, that will be wonderful. It will go a long way in the international medical coding community, and it makes sure that you will never miss a single thing. Let's talk about medical coding in 2022. So the first question that we will answer is, what is medical coding? Medical coding is simply the transformation of healthcare diagnosis, diseases, treatments, procedures, equipments, and services into standard code sets, or what we call alphanumeric codes. In this example, we have a patient named John Doe, who is a 36-year-old patient which has a diagnosis of shortness of breath. So these medical records here are going to be written by the doctors and providers. So what the medical coder does is, of course, transforming both the diagnosis and procedure, into alphanumeric codes such as the ICD-10-CM code, which is for your diagnosis, and also your CPT code, which is going to be for your procedure code. We have here for shortness of breath, we will transform it to R06.02, and your ECG 12 leads, which is your electrocardiogram, is going to be transformed into 93000. There's more into this, but of course, we are here to learn about the basics, okay? Why medical coding is important? First is standardization of healthcare documentation ensures that the information in the healthcare has a common language, so both the providers and the insurance companies understand each other. Number two, making sure that the transfer of information between these two channels, of course, the healthcare providers and your insurance payers, are fast and seamless. Next is it prevents fraud and abuse. It makes sure that the cycle of payment is fair to all the channels responsible, like of course, the payer, patient, and the provider, alright? And it also improves a lot of outcomes in the healthcare industry like clinical and financial aspects. And last, it measures the quality and safety of care even though medical coders are not directly taking care of the patients. But if you are ensuring the accuracy of your documentation and making sure that the clinical documentation is good, it translates to efficacy of care. Okay? Alright. Next is, how does a medical coder works? It usually starts first with a patient coming into the clinic for a checkup. Let's say, for example, this doctor did an examination to this patient who got ill, okay? And what the doctor will do is to write documentation. I'll make it simple for now, but it's usually longer than this. It's not as simple as two-liners like diagnosis and procedures. There's more into this. But let's say pharyngitis is diagnosis for today. And the procedure that was done is an examination. So you as a coder, you will be transforming this two into standard code sets like your ICD. For pharyngitis is your J02.9 if you're following the ICD-10-CM format. And your examination is going to be your CPT code 99202. There's more into this, so you can check my other videos about the CPT introduction and also my ICD-10 introduction for more info about this, okay? And then after coding this, your job is not yet done. You will be submitting that to the insurance company, and of course, you will be waiting for that claim to be paid. Let's say after a few weeks or a few months, okay? So it's not always about this typical work setup, okay? In some cases, you have to step it up by auditing the doctor's documentation, or sometimes auditing your colleagues' work. So we also have revenue cycle management. It's more of the financial process itself, which utilizes a lot of softwares, all right, and it ensures that the healthcare facilities are tracking the patient's care episodes, all right from the registration to the appointment to the scheduling, and of course the final payment of the claim. Okay, so again, I will be making another video for RCM, but now let's stick into this topic. A medical coder can also work as a medical scribe or a transcriptionist. A transcriptionist ensures that the dictation that's being done by the doctor, okay, when he's taking care of a patient, is going to be documented by this guy, okay, by a scribe, okay. And sometimes the scribe of that specific doctor is also the coder. So again, there are some cases wherein it's not just being a medical coder will be your job. Sometimes it's going to be a combo type of what they call this responsibilities that you will be doing. Okay, and last but not the least, medical billing. As I have explained earlier, medical billers are the one that will make sure that, of course, the claim will be submitted properly to the right channels, and of course checking for the payment. All right, when it comes to being denied or being paid, they are the one who will be doing that. Okay, so there's a lot of other work that a medical coder can do. It's not about a single thing about this, all right, but rather there's a lot of opportunities to grow as a medical coder. Okay, next we'll discuss where do medical coders work. And this is very important, especially for the freshers out there. They usually work in a BPO setup, which is a business process outsourcing. Usually, guys, especially if you're from the Philippines or from India, okay, you will be having a lot of BPO companies out there, okay? So, such as Optum, Accenture, Miramed, Shearwater, and Omega Healthcare. And there's a lot, okay, really a lot, okay? Especially in the countries that I have mentioned earlier, okay? So, basically, if you want to really get, all right, a good paying salary, okay, in this field, you may want to work with BPO companies, okay? Okay. Next, second is your hospital, of course, especially if you live in the Middle East, okay? Or so sometimes they will employ their own medical coders to work for the hospital and also for some small clinics and sometimes some dental facilities, okay? And you can also work in health insurance firms or the payer itself, okay? So payers are the one that processes the health insurance claims sent by these hospitals, okay? Sometimes you can work here in this payer side as a reviewer or risk adjuster, okay? So I will be having a separate video for risk adjustment coding, all right, in the future. But typically, you will work as a medical claims reviewer if you will be working with the payer side. You can also work in government entities such as the following. If you live in UAE, you have your Department of Health. You also have your Dubai Health Authority. And other countries such as Saudi, it's handled by SCHS. All right. If you will work in a government setup, that's also good opportunity for you. Okay. And of course, what are the typical setup for medical coders? Yeah, you have two. Usually, it's an office setup, guys, and it can also be a work from home setup. So, a lot of coders during this pandemic transition into work from home setup, which is actually good. Okay, you can have extra time with your family. That's one of the main things why medical coding is such an in-demand job right now. But of course, working from the office is also good because again, you have your colleagues there, okay, and yeah, it's fun, right? I missed working in an office setup, okay? Anyways, moving forward, let's now proceed why medical coding is one of the best careers this year and last year and couple of years back, okay? We have the following reasons. Number one, healthcare career are always in high demand, especially during the pandemic, all right? Healthcare career is always on the rise. Why? Of course, healthcare providers are pretty much needed. Next is you can have the option to work from home. As I've said earlier, work from home setup is one of the greatest thing you can have for today. Okay? More time with your family, more time with your wife, more time with your husband, and so on. Okay? Next is there are many opportunities to move up to other position. Of course, all of the jobs are having, of course, this opportunities to grow. Okay? But unlike medical coding, you can work in the auditing side, you can work in the RCM, you can work in government entities, you can work in the payer side. So there's a lot of opportunities to grow up. And of course, you can manage your own coding firm if in case that you will be doing good in this business. Okay? Next, what are the steps to start my coding career journey? So we have the following. Okay? Do your research depending on the country you're at or planning to go to. Okay? Of course, if you're in the Philippines or in India or any other Asian countries, okay, and you wish to, of course, to go to other countries such as the US, all right, Europe, maybe Australia, or maybe Middle Eastern countries, okay? Again, your assignment is, of course, to check what type of coding guidelines or what type of classifications they're using there from that specific country. For example, if you go to UAE, all right, we use here the classification of ICD-10-CM for diagnosis coding, okay? And of course, the concept of CPT coding for procedure. And for inpatient coding, we use the MSDRG classification, okay? Which, of course, we'll be discussing in a different video. But before you go to a certain country, research first, okay? But if you will be sticking and staying to your own country and you will be working for a BPO setup, they will be providing you, of course, the guidelines on how to do it, okay? We have some medical coding entities such as AHIMA, of course, AAPC. You also have to understand anatomy and medical terminology, which is very important. It will be serving as your baseline, okay, or foundation for medical coding. And next is enroll and study for a comprehensive medical coding course by a qualified instructor, okay? I will be posting down the links below on how to start for your medical coding course. And last, take and pass the certification exam. That's your goal, passing the certification exam, such as the CPC certification exam, okay? So after you pass the exam, what to do next? All right, now you are excited to work for as a medical coder. So what's next? Of course, update your CV and resume, all right, and increase your connection via LinkedIn, Facebook, social media platforms. You also have Indeed, Jobstreet.com, Telegram, and a lot of more job sites that you can check, okay? And that's it. And always remember, guys, before I end this topic, the demand of healthcare professional is increasing, okay? All you need to do is to discover which in-demand healthcare jobs are on the rise. One example is, of course, medical coding. And you have to find out if this career path is for you. Again, I am the medical coding guy. See you next time. So long. God bless you.